Natarajan, he is a Padma Shri awardee and he belongs to Madurai, Chennai. He is over 36 years of experience and he has performed over 60,000 exclusive vitreous and retinal surgeries. And he has trained almost 68 vitreoretinal surgeons, not only India, but across the globe. He is a thorough academician also, and he has written 3 books. He has contributed in 21 chapters in books. He has 203 publications in his name in various journals. And he is the highest invited guest lecturer in the world, having the guest lecture delivered 1,517 feet paid, and this will be 1,518. Right? And he also conducted 61 instruction courses. Needless to say, he is recipient of various awards, including the exemplary work in the medical field. That is the charter inductee in the Retina Hall of Fame. He's one of the only 2 Indian ophthalmologists who share this charter inductee along with Dr. S.S. Badrinath. He also has received the Peace Award Philippines and Man of the Millennium in the Ophthalmology Award. He has established an NGO called Aditya Jyot Foundation for fiddling little eyes and screen around 70,000 diabetic retinal patients, retinopathy patients, 60,000 children. He's acquired the Guinness World Record for performing the most diabetic eye screening in 8 hours. That is 649 screening is carried out screening. He's also chairman and managing director of Aditya Jyot Hospital. He's the president of Organized Medicine Academic Guild. That's what he just a while ago he mentioned. He is the immediate past president of AIOH and OTSI. He is the Secretary General of Global Eye Genetics Consortium. He is the board member of RWC ISOT and is the chief advisor to the Ophthalmic Trauma Society of Africa. So we'll be glad to hear you from Professor Dr. S. Natarajan for next 45 minutes or so. Followed by we'll have the very interactive question answers and sharing the experience. So over to you, Dr. Natarajan. You can take share your screen and start your delivery, sir.
Yes, sir. Thank you very much, sir. And I'm very humbled to say that I'm at the feet of my guru, Dr. Badrinath here. Only thing he didn't want me to be with him because he's 80 plus now, and Madam also is 80 plus. So I'm happy that today is the auspicious day for me because it's my temple here, and I'm at that place. So that's why he gave me this basma and the kumkum. And with this, I think thankful to IAOH-MUmbai branch for having me, and I'll share my screen. And I'm glad to see my old friends. So rather young-looking old friends. No, everybody is looking fresh in the COVID, particularly Dr. Shanbag. And he doesn't look like retired. Correct, Dr. Shanbag? So you can see my screen?
Yes, we can see.
Okay. So I'm just... So my actually experience and learning with COVID-19 from Aditya Jyot Hospital, but I want to say I bring rich experience from as a president of Organized Medicine Academic Guild, which has a lot of physicians, Preventive and Social Medicine Society, then AIDS Society, and many others. And then so we are in all the time discussing with Dr. Shashank Joshi, who is the advisor for Government of Maharashtra, as well as Dr. Sanjay Oak. I'm in touch with them. And also in All India Ophthalmic Society, actually started the Zoom meeting from March itself, and then particularly Aditya Jyot. So I'm involved with many international organizations also. So almost every day we are in some webinar. But I think the only thing is I want to tell here, apart from whatever I'm going to talk on COVID, I have given a talk on COVID-19 happy times. And I know a lot of young doctors were angry and agitated when I gave this talk. The reason is they all thought that everybody is suffering, that somebody finished MS and they could not join work. Somebody just finished their fellowship, they don't know what to do. But I want to tell, it gave a lot of time for insight. It gave a lot of, I know it gave time. Yeah, it's not that only young doctors had problem. I'm an employer. I have 100 staff with 20 eye doctors as a super specialist working. How do I pay? And I managed it. And I think that's because of the positive thinking. So in my YouTube, if you Google, my talk is there on COVID. During the COVID, I gave a talk called Kung Fu Panda and My Life. And I think the reason is I have compared, it's got about 11 lessons from Kung Fu Panda. And I recommend, it's a cartoon movie. It's a childish movie, but the lesson is good. And then second is a Life of Pi. So COVID-19 pandemic, it burdens on the healthcare system as well as our society. And we had a lot of discussion. And I don't know how many of you know, the first COVID was reported by an eye doctor, and he died of COVID in Wuhan, in China. And he was condemned for sending messages to the whole hospital through the WeChat, and he was actually even threatened by the government. And finally, the whole world has given obituary telling about his thing, because he said he's dealing with a fever. He had a patient of glaucoma, and he said it looks like SARS-2 variant, but nobody believed him. And ophthalmic healthcare facility has a risk of cross-infection, and that is where I think three fields were badly affected. The ophthalmologist, more is ENT, then the anesthesiologist. All of them have to deal with the COVID. And not COVID, they have to deal where a risk of exposure is there. I think all of us, have come to understanding, and everybody knows that wearing mask, that's what we propagate SMS. Like sanitizing, wearing mask, and social distancing. I don't like the word social distancing. We call it physical distancing, where the idea is we know that the coronavirus can enter only through mucous membrane. Then why get worried? So from January 3rd to November 26th in India, we have 92,66,705 confirmed cases and 1,35,223 deaths due to COVID. So if you calculate is 0.01% of India, that means 99.9% of the COVID patients survive. So I think nothing to worry. But at the same time, we cannot take it light, because there are patients who have died, doctors have died, and I think the number of doctors around 300, and number of policemen have died in Mumbai and Maharashtra about 300, and that's because of you don't wear the mask, or you don't keep sanitizing your hand. The corona effect, and I think it has affected very badly in many places, including economy. But I don't know how. I was all the time smiling and happy, even though I had a financial crisis in the hospital. But I'm happy. I think it got sorted out. It didn't get sorted out on its own. We had advisors, and that's what Chanakya says, and my friend Shivanandan says, and he's my advisor. And I think you have to seek advice like a king. And king takes, that's what Tirukural says. You have to have 5 ministers to advise you, and then finally analyze and take up the idea and see which fits you and fits the people and do it. And that's the same thing I did for COVID. It changed many aspects of eye healthcare delivery. And I'm sure I attended the previous Dr. Nikhil organized for IAOH. I saw how it's affecting the COVID at the workplace. So we had to do the warlike preparation required on healthcare front. We have Ramayana, we have Mahabharata. So I think it's the same we have to follow. We have to have the outpatient management, inpatient management, and healthcare infrastructure. And infection management and control should be prioritized at eye hospitals or any hospital or facilities to minimize risk for patients and staff. And this is what I keep telling the patient and my staff, particularly I remember every April 1st onwards, I didn't see patient, but I came to the hospital every day because I had my 103-year-old grandmother, so I didn't want to see patients. So April, May, June, I didn't see patient, but I visited the hospital daily as a surprise check to find out whether they're wearing masks. As soon as they go, they will wear masks. And they will tell me, sir, you come at late night and here nobody's there. I said, come on, here, that's where the virus goes in. So make sure you protect yourself. But if you protect yourself, you're protecting your family, your friends. Same thing with the patients. So I think that's the key point. And the corona changed many aspects of healthcare delivery. And then here, patients attending ophthalmology clinic screen for fever. And I think this flow chart is known to everybody, the triad system, which is used for any hospital. And I'm glad to say I'm working with Dr. Ramanan, who's running a company called HealthCube. And we are doing a study on using a HealthCube, which is having like a small box which can be connected. I think my fellow Dr. Aishwarya prepared it. I think she's not added it. And we hope to come out Dr. Radha Rangarajan, and she's another PhD. They both are epidemiologists of the highest qualified with the experience in India, but they all work for US, and they have the company in India, and which is connected with the sugar testing, HbA1c, lipid profile, and then COVID also, the history, and we are going to use it in AI. But this is what we are doing physically. And patients with conjunctivitis was a big issue in the beginning. And because there has been reports that this virus can produce conjunctivitis, to be taken directly to an isolated room and be directly seen by a doctor wearing a PPE, and treatment for conjunctivitis alone will be instituted. And no other tests, including visual acuity, should not be done. And we told not to interact more. So we devised a thing called teleophthalmology. It's nothing new, but what we did is a modified, where I tell my reception and the doctor to talk to them on the phone more than in person. And I saw Sion Hospital had introduced one technology where everything was totally airtight, watertight, and then they had a sound system, they had a tele pulse monitoring, tele temperature monitoring, but we couldn't do that, but we did this. And so that's what I think we have to do. And a suspected patient, for a patient with suspected COVID, use a separate OPD from within an isolated waiting area. And now we never allowed anybody with suspicion. But when we come to know, we at least treat them separately. And the OPD room should not be positive pressure. Sanitize the room after the patient exits, and the next such patient to be examined after 20 minutes gap. And this is what we are doing. And that's why it takes time. And that's why I tell patients relative not to enter the room, because I think this the problem is, I'm traveling now. I was in Salem, Coimbatore, and Yerkad last week. 3-4 days I was in Bangalore. And it looks like nothing is happening in the cities. I don't know how. But and I'm wearing mask all the time. But now inside the house I'm not wearing. So I think this, instead of social distancing, we should use the word physical distancing. And even if the patient is asymptomatic, reduce waiting time. So telemedicine and AI-based eye care delivery to reduce non-urgent appointments. Limiting close physical contact is the key to helping reduce the spread of the disease. And as an ophthalmologist, as an ENT, and anesthesia, you have to go, so you have to wear a shield. And a lot of doctors faced that wearing shield is a problem. But I travel from my home to the airport, and till I get down and get into the car, I wear the shield, I wear the protective goggles, I wear the N95 mask, and I wear the gown, which is the surgical gown. And then gloves I'm not wearing now because I'm sanitizing my hand. And I come back and I do it. I think I made it a point. We can wear the glove and like a surgeon sit and operate for 3 hours, and plastic surgeon operate for 12 hours. Why can't we be in the mask and gown and with the face shield? I don't remove, I don't drink water, I don't eat anything for the time I'm in the public. When you come inside, remove the mask and wash your, and I have Chinese professors, a lot of friends. And I have to tell you frankly, December 20th to 23rd, I was in China in a place called Jinan, where Confucius was born, and nobody knew because nobody let the secret of Wuhan out. And then I was in another place called near South China, near Hong Kong, 1 hour from China. And nobody knew, and I was addressing them because they paid my trip to teach them, and I was teaching them how to publish in Scientific Citation Index journal, because they felt Indian Journal of Ophthalmology is great, and I was editing it for 6 years. But I mean, nothing was happening. But then later, suddenly, December 29th, they announced, and then January, the 1 month it took WHO to announce it's a pandemic. So I think the whole world, I don't know who took us for a ride, but we all were taken on a ride. And it was a roller coaster ride. And I think we are still part of it. So we had eye emergencies. We never closed the clinic. We had all these emergencies being taken care. And we had, this is a big list of 20 emergencies we were tackling. And subspecialty-wise triage of ophthalmic clinical situations were adopted. And this was adopted from the guidelines issued by Royal Australian and New Zealand College of Ophthalmologists. And we were also, All India Ophthalmic Society has issued it. We also follow the guidelines of American Academy of Ophthalmology. And I'm happy, as a part of the All India Ophthalmological Society, we have published in Indian Journal of Ophthalmology all the guidelines for ocular trauma, ophthalmic trauma, and prevention, as well as anesthesia, ophthalmic anesthesia, and oculoplasty. And we have 15 subdivision, and we have guideline. And I'm happy we took the lead even same time as American Academy. And this is how the comprehensive ophthalmology, how see immediately, urgent, routine. And now I think most often everybody is coming to routine, but we have to still follow the physical distancing, sanitizing, wearing shield. And I think this is, I think we should follow. Nowadays, I operate with PPE. For examination, I have the shield in ophthalmology. And this is, I'm not going into detail, because all of you will know. And then as an eye doctor, I think we do all this precaution. And we recommend, like a ready reckoner, it's available in the IAOH.org website and our own inside the hospital. So there are also how we can do rescheduled teleophthalmology. So the high-risk areas we classified as the operation theater, registration area, outpatient room, counseling room, consultation room, patient waiting area, lifts, washroom. But these are the people continuously used by people. So we modified our infrastructure management. So we have I'm happy all over I see, including temple. Yesterday I went to a temple in a remote village about 45 minutes from outskirts of Chennai, and they had all this. They had put no mask, no entry, and non-contact thermal, and this is the wrong way in the beginning. Now they do it in the hand, and we have one patient at a time. We can have a glass door where you see, the cashier can see, and then take the money. And then a slit lamp shield. When we examine a slit lamp, we have a shield between the examiner and the ophthalmologist, so that nothing happens in between, so that we can do. And then we make sure the relatives don't come in. And this is again to show the shield. Again, we need a transparent shield, which is there behind the camera. And then here you see our cleanup boys cleaning continuously. And I make them clean in front of the patient so that they know we take utmost care for doing all this. And this is the lift being cleaned, and then the chairs being cleaned where the patient was sitting, and then the staircase and the handrails. We tell them not to touch, but Indian habit, they touch. So, and I tell them all of them to wear a glove. And if it gets soiled, they throw it and wear another one. And you can see one Dr. Jaydeep, and I think this is me. And we are wearing face shield, we are wearing PPE. But I feel in outpatient, you wear a shield and have a glove and a regular gown like the other optometrist is wearing. I think that's enough. And then here you see they wear the surgical gown, and then the glove, and then the shield, and then the protective goggles, and then patient wearing the mask. And then we do all procedures in the optometry, and only one patient at a time. Okay, the video is not working, but no problem. So again, showing the video how I scrub and I wear the PPE and then do the scrub. And then we wear over that, we wear the full sleeved gown. And I want to say that I do the 3D vitreous surgery, which is the 3-dimension surgery like the laparoscopy. But the laparoscopy, I think, is not a 3D, it's a 2D. But here we see the entire eye on the big screen and operate. It's like seeing a 70mm movie and operating. And you can see I'm wearing the PPE, I'm wearing the sterile gown, wearing the N95 mask, and then I'm sitting with the backrest and then doing. And all surgeries are daycare with minimum staff done by senior ophthalmologists with the quickest surgical procedure. But and see, this is the screen I see, and I don't use the microscope. And that's the latest technology. We got it in January. So I do that daily. And I think I'm one of the authorities on using 3D surgery. And it helps me because you don't close to the patient. You have a 3D goggles, which is protective. And then everything is covered, and we operate. I have double glove, and the entire patient is draped. Make sure there's no air coming near the eye, which is needed for our observation system. And you can see the regular microscope is kept up. And this is, I don't have any financial interest. It's a Zeiss microscope. We call it Zeiss RTO 850. And this is what we do. And then again, the same thing in the OPD. And this is, again, we also taken part in the Government of India program, Workplace Assessment of Safety and Hygiene, called WASH program. And that's again from the Quality Control of India, hygiene and safety, personal hygiene and safety. They have the guidance. So we have to pay a fee, and then they do an inspection. Everything is done online, and then they give a certification. And the idea is not for certification. The idea is to follow so that you can take that same thing for your homes also. and the equipment and surface infection, and we disinfect every instrument being used, and also fogging at the time of slit lamp for both doctors and patient, and the indentation all patients may not be possible. Periodic cleaning of all instruments like slit lamp it's a mandatory, and I make it a point. They do it. It's costly, but I think it's worth it, because one, you have to safeguard yourself, and when you go back home, you have to safeguard. See, I had a 103-year-old grandmother. She passed away naturally last month, October 8th. But we have to protect her. So I used to wash all the clothes in hot water, take bath, even though sometimes people said I'm paranoid. No, I'm not paranoid. I was taking extreme precaution by doing that, by taking bath and every time, and then going and making sure you scrub your hands for more than 20 seconds and then sit with your grandmother. I think that gave me the safety, and I'm glad she did not get any COVID. And post-operative follow-up, this may not be possible as frequently as before, but I think whatever required, we can do it now. And there's a decrease in the number of patients visiting hospital in spite of unlockdown, though numbers steadily. And this is a problem eye doctors are facing, because all eye problems are being neglected by telling, oh, eye can be tackled later. Today also, in the morning, I was talking to Dr. Badrinath about that. He said diabetic retinopathy is increasing. I said not increasing. The diabetic problems are being neglected, so the blindness is increasing, which can be prevented. So Dr. Venkateswamy, the founder of Aravind Hospital, said they are all called needless blindness. What is the meaning? I think you need to take care of your diabetes. You will take care good by doing an OCT, fundus photo. You can prevent diabetic retinopathy. If not, at least treat them early and make the vision good. So come late, it's a problem. So this is a chart showing the number of surgeries and everything is come down. You can see the graph. It looks terrible, but I'm hopeful. I think one day we will bounce back. And then the main reason is a fear of contracting COVID, and then a financial instability for a common man and patient. This is what the number of patients you can see where injection is for age-related macular degeneration. In the first quarter, only 6 patients, and later in 40. And then the empaneled patients, delay in payment from government hospitals, even though our finance minister announced in March 27th circular, all government payments like CGHS, ECHS, railway, or MGP, and many things, they are not given. Can you believe we were having some 40 lakh spending, and we were still struggling to get that money back? And COVID era, people prefer home food, preferred over 5-star hotel food. Similarly, local inexpensive quintessential machines would be preferred over costlier machines. And reduce. They all want to reduce the number of clinic visits, and then reduce cost to the patient and hospital, reduce risk of COVID-19 transmission by limiting gathering of patient. But in spite of that, I think the necessary patients have to come. And I think we all doctors have to give that confidence to the patient that we are all COVID protective, and we will make sure. See, because there's nowhere, nobody can prove from where the COVID came. You're going to eat vegetable, you're going to buy vegetable, you're going ordering food, your driver comes, your servant comes. And in my house, 8 months, nobody went out. They all stayed within the house. I told them it's life of pi. The cook, the 2 boys, my grandmother and me, and all the 4 were the like the pi, and I was the tiger. So in that movie, that pi will say, "Oh, what's Sana?" He will tell when there's a storm. He says, "I don't know what to do. If I am hungry, he'll tell the tiger." Pi is that president, that name. He will tell the tiger, if you are hungry, I am in danger. But if I have to live long, I have to feed you. So for that, I need fish. So you have to catch fish. So he says, I don't know how to catch fish. And then all the fish will come on his hand. And same thing he will tell, if you sleep, I can sleep. But if you are awake, I have to be awake. Otherwise, I will die. You'll eat me. So they will play the game between the boat and the extra outside of the extension. I think that is what we lived, 4 to 3 servants and me. And I told them we are a family and we are all same. We are related. There's no question of blood relation. I said, wherever I sit, you can sit. We follow the rule so that there's no question of getting angry. I said, I controlled myself. Not control. I think I let them go free. I said, do what you want. We had 3 televisions. I said, you watch one channel, I'll watch one man, and one my grandmother can watch. And that's what we lived. And I think we have to have a new now, and that's what we have to do. And teleophthalmology is to encourage patients need and retinal surgery with all precaution. But I'm sorry to say, in spite of all the advances, people want to talk to you, people want to touch and see, and then that's the problem. And we are having and we made publications along with our Akshay Nair. This is one of the highly cited article, Effect of COVID-19 Related Lockdown on Ophthalmic Practice and Patient Care in India, results of a survey in Indian Journal of Ophthalmology. Then as the Retina Group, we made a guideline in the Indian Journal of Ophthalmology. This is again Vitreoretinal Society of India. Of all this, I am a founding member as well as a past president. And then we made this Corona for ophthalmology, C for take care while performing, O for optometry workup such as refraction, O for ophthalmic evaluation, N, do not touch your eyes, face, and A, avoid risk of infection, stay safe, be happy. I think this is what I learned from Dr. Shashank Joshi. I'm sure you all know, one of the top endocrinologists in the country, who always said, which I didn't realize, and I attended a course called Anamika Chauhan's Magnificent Morning. What did it teach me? It taught me to get up at 5 in the morning, and every day between 5:30 and 7, there was a class. The class was on everything on life, including money making, including how to have a relationship with your relatives, your own wife or brother, sister, hospital staff. Because in COVID, whether you're a chairman or a servant, you're all same. You're affected badly in all angles. And how to live happily? Everybody has the same problem. The servant doesn't have money to buy, you don't have the money to pay. So we created it, and I think I'm happy. So Dr. Shashank Joshi told, which makes sense. And this Anamika Chauhan, she's a PhD in humanities from IAOH-MUmbai. And she said that if you sleep at 9 to 10 and get up at 5, it is called circadian rhythm, which as a doctors we know. And Dr. Shashank Joshi said there are publications. If you follow the natural biological circadian rhythm, it gives immunity against COVID. And he says it's very important for COVID warriors like doctors who are working with patients. And I think we have to learn to sleep by 9 to 10, get up at 5. It's not that 8-hour sleep is important. It is that 6-hour sleep, either starting at 9 p.m. or 10 p.m. or 11 p.m. and getting up at 5 or 4:45 or 5:50. She says don't get up in the same time. Don't keep alarm and get same time. You keep alarm one day at 5, another day at 5:10, another day at 4:50, so 5:25, and 5:30 you do all your, and you won't believe, including your morning natural call will come sharp at 5:30. I can't believe it. It happens even today for me, only because of this travel last 4 days. Yesterday, I slept at 2 o'clock after the wedding and got up at 5, so it was deranged. But today it again started again. I slept well. So I think sleeping well, I never realized when my gym trainer always told me, doctor, you are a doctor, but you don't know this. You need only oxygen and water for your brain to work. And it's true. The brain is made of more than 90% water. And then we need water because of the cells needs water, and then it works. And it's for any cell metabolism. And it's true for brain. And then the reason is when you do exercise, you breathe well. And that's what is yoga. When you deep all sorts of deep breathing or pranaya or I did that Sudarshan Kriya, and I learned. So all that will help you to have deep breathing, which will mean you take more oxygen, let out carbon dioxide, which is what is important for COVID, because COVID affects lungs. And I think if you protect your lung and also post coronary surgery, I think if you keep your lungs strong, and I think that's what our Prime Minister is doing through the International Yoga Day on June 21. We are also doing a project with the SVSI University, which is Swami Vivekananda Yoga Arogya Netra something, where they are trying to use yoga to control Ayurveda, to control diabetes. And we are doing allopathy, and I want to mix it, finally give the best to the people. We have 77 million diabetics. And I want to tell, this is my last slide, and I want to tell to everybody here, I have decided, and I think the life is divided into 4 parts of, I forgot right now, whatever. And the last part is sannyasa. And before that is one, I don't know whether Dr. Shanbag or somebody can help. The 4 parts. The sannyasa is you start meditating, and before that is you finish your graha pras. That means you finish your life as a father, wife, husband, and whatever duties. All that I have finished. So now I also want to encash my hospital and do a lot of service. So I want to follow Swami Vivekananda, and sometimes I tell the Bengali patient I'm a Swami Vivekananda reborn. And he said that take that one idea. So now my only idea is we have 77 million diabetics. Every doctor is ready. And I suggest that you prevent diabetes, or if you detect diabetes early and then treat them, you can postpone or prevent all complication. You cannot make it zero, because diabetes is from the time of diagnosis to grave. But if you control like an animal from the day one, when the small dog you get as a pet, you train with a trainer systematically, scientifically, and the dog will listen to you. And dog will, that's why the sniffer dogs and the police dogs and are all trained. They can bring everything. So similarly, the diabetes can be done. So I want to do that. We have 77 million diabetics spread over 6,47,747 villages. So I made a program with the National Skill Development Corporation of India, and I want to address all these villages. And I'm going to use teleophthalmology, and I'm going to use illiterate people, right? Maybe Bihar, UP, Maharashtra, Tamil Nadu, anywhere who are studied and not having job, or women in the villages who are wives of farmers who are working and they are not working. So I want to empower them by giving the technology of using a smartphone, so that they can use the smartphone with a device from a Remedio company. I don't have any financial interest. And then find the NGOs to support them and screen every diabetic, and then some money for doing the test for HB1AC. And that's where Health Cube comes in. So that's my idea. So as Swami Vivekananda said, I've taken up that idea. Take up one idea, and this is my idea. Make that one idea, yes, Nikunj, I will conclude. Last slide. Nikunj?
You can go on. You can go on. Sorry.
Okay, no, I saw Nikunj's phone.
No, you can go on.
Okay. No, I'm finishing. Anyway, so take up that one idea and make that one idea your life. And that's my life. Think of it. I'm doing it. Dream of it. Live on it. That idea. Let the brain, muscles, nerves, every part of your body be full of that idea, and just leave every other idea alone. And this is the way to success. And that's what is a spirituality, success of spirituality. And with this, my pranams to my chief who is here, my mentor, Dr. Badinath. And I dedicate this talk to him, even though he's in the other room. I'm not able to take there, but I'm open for questions now. Thank you very much, Dr. Nikunj. Sorry, maybe I extended my time. I became a little emotional and lost track of time.
No, sir. You have, in fact, not exceeded the time. You have managed the time very well. And you cover all the topics, right from the prevention to the treatment, extending beyond the patients to the family and the caretakers. And also you have touched upon your vision and idea or your motivation at this age of experience and life. So this was a very nice information to all of us, sir. It was not in repeating. We know what to do, but actually practicing what are the difficulties and what are the challenges. It was from horse's mouth. We have learned a lot, and now I keep it open to the audience to ask any questions, any queries to Professor Dr. Natarajan.
So there is a question from Dr. Rawat. Are you doing RT-PCR tests in preoperative profile? Yes, sir. We are doing for retina patients 100%, and cataracts patients, we are leaving it to the cataract surgeons. I think our Dr. Kavita Rao is asking for RT-PCR, and other doctors who are doing topical anesthesia and finishing the surgery in less than 10 minutes, they are not doing it. So I left only that part of the protocol. Our hospital protocol is every patient who is going to OT, if it's going to cross 20 minutes surgery, we are doing RT-PCR. And for my patient, because I am 63, but I look 18, and I'm like 18, but I take all precautions because everybody is concerned. I won't use the word worry. Everybody is concerned for me. So a lot of people told me, why you want to make money and do operate? I said, no, I'm not making an operation for money, but I said, my skills are there and I cannot sit at home and keep on telling, do this, do that. So I'm in the war field. That's why I did it in Kashmir. Even now I want to go to Kashmir during this winter. So I went to Kashmir and operated, no protection. Shivanandan said, you have guts, you go. So same thing, I have guts, but no blind guts. As a eye doctor, I will tell, nobody should have blind faith with God, and nobody should do anything blindly. Everything should be evidence-based medicine. Everything should be following a scientific protocol. That is why this vaccine, according to me, the whole world is bluffing, and all of us are part to it, including government and Dr. Fauci and Dr. I think I have a strong opinion. Anyway, that's different. I don't know whether it's in this thing. I'm not tell, but I'm trying to analyze. I mean, I don't know how can you get a vaccine which will protect you, and that too shortly.
Thank you, Professor Natarajan. In fact, Dr. Raut is our national IAOH president, and somehow he's just, Dr. Raut, sir, I just introduced that you are the national president of IAOH, and he's one of the very experienced and not one of the most experienced person in the field of the vaccines and preventable disease. So, Dr. Raut, sir, I'll request you to share your views and comments on today's topic and your world of business.
Good evening, everyone. I will not talk much about the today's topic, but briefly I can tell about the vaccine status. So this Covishield, which is manufactured by Oxford Institute, the trials almost finished. The report has to come. Initially, they have recommended 0.5 ml dose, 28 days apart. The first dose will be on day 0, and the second dose of 0.5 ml will be on a 28 days. Now they are saying that if you give 0.25 ml dose, first dose of Covishield, and second dose of 0.5 ml, that is second dose is always a booster dose for Covishield and even with other vaccines also, that is Pfizer's and Moderna and Sputnik 5. All the vaccines are having 2 doses. But with Covishield, they said if you give 0.25 ml first dose and second dose 0.5 ml, the immunity will be better than giving 0.5 and 0.5 ml dose. So there will be 90 to 95% immunity observed with 0.5 and 0.25 and 0.5 ml dose with the Covishield. Though the first trial, I think, over of 0.5 ml, I think they may go for this 0.25 ml and 0.5 ml dose trial. Another vaccine is Sputnik 5. The Sputnik 5, again, the doses are 0.5 ml and 0.5 ml. But the problem with Sputnik 5, that is we have to maintain at -degree centigrade. While with Covishield, you can preserve at between 2 to 8 degrees centigrade, and very easy to carry anywhere in the country and even remote area also. But it's difficult with Moderna and even I think Sputnik 5 also. And Pfizer, I don't know much about, but the doses are same, like 0.5 ml and 0.5 ml. Moderna is also same, that is 0.5 and 0.5 ml dosage, that is the 0 day and 28 days. But with Sputnik 5, the first dose is on a 0 day and the second dose will be on 21st day. While with other vaccines, it is 0 day and 28 days. I think this is in short the doses schedule, and all doses are intramuscularly injected on a deltoid. And Dr. Natarajan, I think it's wonderful information as far as ophthalmic surgeries and Department of Ophthalmology, how we keep all these things updated and sterilized wherever the chances of infection is there. I think I have seen the figures, it's wonderfully maintained. Thank you, Dr. Natarajan. It was very informative for all my occupational health physicians. So even they can follow all these things and convey the message to all those who have not attended the talk. It's a wonderful talk, definitely. Thank you.
Thank you so much, sir.
Thank you, Dr. Raut. Before we go for the next question, I would request all of the participants to start your video so we can have the we can see each other. We can have a screenshot also. There is another question from Dr. Sandeep Suna, who has complimented Professor Natarajan for his love on ophthalmology. And he also has a question whether any antiviral ophthalmic drops for the use of COVID eye symptoms.
Yeah, I just saw the question. Thank you, Dr. Sandeep Sharma, for your comments as well as the question. I think the antiviral drops are we are not sure. See, first of all, I think when the conjunctivitis happened in a COVID patient, it was not actually a COVID conjunctivitis. That's what is my impression. There is no way to prove in April, May, and surprisingly, there's no conjunctivitis seen now in the last 3-4 months. So I don't think any publication is also there in the last 3-4 months, as far as I know. But I can be wrong, because we say in Tamil, what you know is the size of fist, and what you don't know is the size of the universe. And that's what Avayar says. I really don't know. So I think there's no antiviral drops for COVID, because the problem is, even for COVID, you don't have an antiviral, which is proven. No, I don't think we are giving that remdesivir, but I think that also you have to give it in the correct time, and every person is not affected. And when the remdesivir were introduced in the US, and we were trying to get it for my friends here, my classmates who are working in the COVID, they were telling me that remdesivir is only a supportive and not a real anti-COVID. So that way, there's no antiviral. And there are antiviral eye drops, but it's not for this. And pink eye is a symptom of COVID, has been published, because there are some patients who had only pink eye. And that means conjunctivitis. And they didn't have any other symptom. It is like a slight sore throat. And I have one of the a guy who had only, he was saying that suddenly he lost taste in a day, 1 day old. And he remembered the symptom, and he went to the doctor and got a testing done. He was positive. And because of that, he said he didn't have fever, nothing, only lost taste. And he got tested, and 5 days he was on remdesivir and other drugs. And he himself said, I know about steroid. He's not a doctor, he worked in eye care. He said, I don't want steroid. So I think the treatment being given to COVID, because whatever physicians I have interacted, they all tell it has to be some antiviral, and I started the right time, and not waiting for the symptom to have problem and then get into that. And fortunately, only the fatality happens in very, very few people with comorbidities. And that's why my idea is to detect diabetes early. So it will help to warn the patient and do everything.
Thank you, Dr. Natarajan, sir. Dr. Sandeep Sharma, you have any further comments or questions?
Thank you, Dr. Divyang, and thank you, Dr. Natarajan, sir. You have given a very broad overview of this ophthalmic care during this COVID pandemic, and we appreciate your passion for continuing this ophthalmic care, because right now what people are afraid of going for any surgery or even for any minor problem which they have to the hospitals. So like teleophthalmology and the surgeries which you are performing with all due care and with all the protection, that is very important. And it gives a lot of confidence to we all industrial physicians, especially that everything is safe if you are getting treated from a person who is taking all precautions, and nothing will, you don't have to worry for any complications or other things. So that is a great contribution by you, sir. And I asked this question because this like Dr. Nikunj has also asked, this pink eye and this conjunctivitis was taken as one of the early symptoms of COVID. So yes, that was the reason why we asked this question.
So we have one more point also, which some of the doctors are saying, which I'm not convinced. See, we diagnosed the first case of COVID producing branch retinal vein occlusion and central retinal vein occlusion. And later, there are several reports from all over the world that COVID produces vascular vasculitis and vascular obstruction. And which is happening in the retina is the most important we can see. So yes, today in the Hindu in Madras, my student, Dr. Natarajan, has published that it also produced affecting the third cranial nerve, oculomotor nerve. So I think the late symptom, if you have seen, I don't know whether there's a publication which says after the patients have been discharged after treatment of COVID, they have either have complication of deep vein thrombosis or died of some heart attack. And it's all because of COVID, I think. So I think we have to really keep a watch on this. That's where the role of steroid judiciously by physicians is very important to kill the vasculitis, and then also vascular obstruction. And retina has one of the smallest blood vessels, and next is kidney and maybe heart. But all the blood vessels are bigger than retina. Because the retinal blood vessels are, that's why Sundar Pichai is trying to use the AI and diagnose and predict IHD. And we are the first ones to publish in the world that we can use an offline AI to diagnose diabetic retinopathy, and by like a peon, your peon or a boy who's in the clinic, we are training them to use the smartphone and take photo. So I think according to me, including the vaccine, Dr. Rao gave a correct thing what is happening. But I actually wanted to ask Dr. Rao, the question is, my personal impression is I'm not, generally even influenza virus I never take. My friends, I remember they take, and then sometimes they have fever, as usual, a normal reaction following this one. So I'm not sure. Why not we have develop immunity is my point. And that's how even taking food and taking good water. And if you go to America and come back, you have a problem with your own water. And that's a problem of your immunity goes down. And that's what my friend earlier in April, he said, see, our floors are with all the time with some bacteria and virus. And never like America where everything is clean and everything is sterilized all the time. That's why their immunity is down. That's why New York and some places suffered a lot. And I know how it happened. So I think in India, we are definitely with such a big population, and particularly Dharavi, I think people didn't die like what happened, what they expected, like a mosquito or flies will die. No, it didn't happen. There's something happening in India. So they were making a big theory about BCG. Nobody knows who protected whom. So, but I think overall, I know better to take precaution, better to err on this side of taking precaution rather than being casual. The doctors have died. And then my own classmate radiologist, he in Madras, he had a COVID, but his wife and his uncle died. He survived. And he's devastated because his wife died, because his wife didn't go anywhere out. Only he was the one who went to hospital and came. So that is why I think whatever you're appreciating is my to give confidence to every patient. Don't neglect your eye. Don't neglect any health problem. Go to the hospital. Take all precautions. I went and did a free service after my grandmother died. My friend Shivanandan was making fun of me. You're going like a cosmonaut, and how can I tell the trustees distributing free food? Nobody can identify. I said, doesn't matter, I told. I don't need identity because I am doing from my heart. Because as me and Shivanandan, they're distributing 10,000 meals a day, daily free. And during the COVID migration of servants, we paid, we gave 37,500 people daily free food. And I don't know how long we have to give, but Shivanandan has collected, thanks to all the companies. I don't know which companies, and they have given 6 crores for him for next 3 years without any other problem. I have only signed check, and Shivanandan will get executed. We have 10 vans, 10 drivers, 10 helpers, and 5 cooks, and a big kitchen in the Chembur, where this people who make the metro have given us a place. So Shivanandan is doing a great job. So what I'm saying, in the COVID also, he was going everywhere. We used to tell him, you are 70 years old and how can you go? Another example is Dr. Madhav Sate, who's an anesthetist, and he was giving anesthesia in May itself. My anesthetist, same 1 year younger to him, 70 years old, he has not come out of the house still. So I think you need a willpower to have immunity and also follow scientific instructions of taking precaution. I don't know how long to take, but we have to take. And then any suspicion, treat him like COVID, and then make sure you're protected, and so that you live long and serve the people.
Yeah. Dr. Divyang, can I say something?
Yes, please, sir.
Dr. Natarajan, always passionate and motivating as usual. Excellent presentation, sir. That is what was expected, and you gave a good overview. I have a couple of questions.
Yes,
question number one is, in your setup, how many of your medical staff were affected with COVID?
Fortunately, lot of people developed fever, They all got tested and negative. That's good. I don't know how it happened. 100% of them are negative.
Excellent.
So it's really commendable. I think I can only give credit to God. I think we have not done anything except brainwashing and training. And instead of punishing, I went to everybody and told, this is for protecting you and your family and not for me and not for yourself also. So you have to live to protect your family. This is what I went and gave a talk to. Every day they'll pull the mask and they'll talk. I said, come on, yaar. The idea is to protect you first, not me. And I told them, I will give you any number of N95 masks, any number of gloves, any number of gowns. You waste it, no problem. But I said, use it.
Okay. The second question is that's what I'm talking about, the frontline workers. It is said that you also stress the importance of using the PPE.
Natarajan.
Hello, can you, whoever is speaking, can you put your mic off, please? Yeah. So what I wanted to ask you is that you have stressed the importance of PPE.
Yes.
It has been stressed by a lot of experts that donning and doffing of the PPE is very, very important, especially
Yes.
doffing. People get infected. The infected PPEs, when you doff the PPE, that is the time you normally get infected, is what people have said. Experts have said. So can you give us some tips of how to doff and how to don the PPE?
I know. Actually, even I said it. It's cumbersome, and I think even wearing is cumbersome and removing is cumbersome. So I think the one is I remove the glove last.
Okay.
So even though it's under the thing, so I pull it off and make sure I make somebody with a gown and a gown to remove that, so that he immediately packs it. He doesn't touch anything where he's also covered, and then puts it in the place to dispose. So I think that's important. But one good thing about at least Aditya Jyot is, because of being a high hospital, in March itself we started screening people. And I remember a girl came with a road traffic accident from Delhi. She's originally from Silchar in Assam. And when she came, while talking, because I took 2-3 days, 2-3 visits, talking, last day she told me she went to Italy and came. Then I got my antenna opened up and I asked her, did you do the test? Then she said, I got a test done in Ramana Logia Hospital in Delhi and I'm negative. So I got the test. So again, on the day of surgery, she herself called me and said that I'm feeling feverish. So when we checked, she didn't have fever, but I insisted, I canceled the surgery. I sent them to Kasturba Hospital in Bombay and got it verified. And they said it's negative, you can operate. But anyhow, the patient came 2 days later and we operated. But can you believe, that was on March 18th, I think. And all my doctors that time blamed me, saying that Dr. Natarajan is not only operating and exposing himself, but he's also exposing all of us. But I never said. So I told them from that day, whoever is afraid, please don't come. That is the best immunity. If you are not having confidence with yourself and your surgeon or your team leader, then why come? It's like going to a war, no? If you can't hold the gun, and why you want to come to the war? So same thing I told them. So same thing here. Fortunately, I think we did not allow any suspect. If, for example, if somebody had a fever in the house, we tell them, you quarantine yourself, don't come, and we'll pay you for a salary. We did that. We did definitely a 40% cut, but we paid that. So if he declared of a fever, we didn't cut his salary. So we took utmost precaution. That's why I said Dr. Ramana has created that health cube. So we do the testing. There's a 3-page questionnaire that which AI is used. So to find out remotely, they gave the high risk, moderate, and mild. So if it was moderate, they inform the surgeon, and there was a question whether you would allow them, including staff, into the hospital. So if it was severe, no question, we send them for a RT-PCR test. But it was moderate, then the surgeon took the decision. But as I told, Shashank Joshi told me one more point. One is during the wearing, then removing the PPE. And second is, as I told, the corona does not go through skin. So even if you are not washed and you are touched it, the only thing is we are not working in the COVID positive patients. So I spoke to my classmate in US. I'm not sure about, I saw various videos about interns in India. But in my classmate, he said everything is monitored tele. That means entire ICU is monitored from a room outside. Except when there's a need, they go 30 seconds. For example, some injection to be given, they go 30 seconds, no talking. Everything is through the tele audio. That means there's a microphone, there's everything. And then they talk from there. All the talking is done from outside. And then Dr. Ishwar Gilada's daughter was pregnant, and 6 months, 7 months of pregnancy, she went to the hospital. Well, we did a study on doing a fundus photo and COVID on a COVID patient. So we also told whoever is not afraid of COVID, only those optometrists, we took them and we trained them, and they did it in Messina Hospital. Thanks to the Messina Hospital for giving we did ethical committee approval and did it. So fortunately, eye doctors are not exposed to any COVID patient, active patient remotely also. And if you do all precaution, we were not, but still I tell them, because a lot of surgeons all over the world, I think, have decided they will wear only a surgical gown, not a PPE now. I am still wearing, as I told, because everybody tells you are 60 plus, you have to be careful. So I have decided, okay, I'll at least show the world I'm doing the PPE, and I'm doing it. And I have decided there is no, laziness in doing it. And while flight also, I'm doing that. And everybody looks like me. Sometimes in the Coimbatore airport, they ask me, what is this dress? They ask me, are you a cosmonaut? And they were joking. I said, I know, yaar, my whoever is calling me to their house, they want me to come like that. Otherwise, they said not to come. So I have to obey. So I'm doing it. So I take a photo and put it in the Facebook also.
Anyway, thank you, Dr. Natarajan. And let me just correct you. You said you are 63 and you look 80 or whatever. But I can tell you, you are 63 and you look 36.
Thank you, sir. Thank you.
All the very best.
That's because of my Mata, Pita, Guru, Mitra, Deva.
All the time.
Yes. Sir, Dr. Rawat, happy to know that you are the president of IAOH, and as a All India Ophthalmic Society, we can do something together, sir. And I'm still the past president in the governing council. Sir, Dr. Rawat, he is muted.
He is muted.
Yeah, Dr. Rawat, sir. Dr. Rawat, you are muted.
You are mute.
You are muted.
Dr. Rawat, you are mute. Yeah, please.
Yeah. Yes, tell me.
No, I am the immediate past president of All India Ophthalmic Society, as well as I'm in the governing council. So we can do something together, sir, because this COVID at workplace ergonomic problems are many for doctors, no? Particularly eye doctors. We have neck problem, we have a back problem, and then so I have designed a chair also, ergonomic design for operating chair. And I recommend every surgeon to learn dancing so that their back is strong, and both the antagonist and protagonist, and it all comes under, I think, occupational health.
Okay, we'll definitely go.
And my classmate is a professor of occupational health in Malaysia in a university. I keep telling her, she did some study on police also. I think we should do some joint work in the occupational health field along with ophthalmic.
Yeah. So I'll get your number from Dr. Shah or Divyang.
I will just put it in the chat now.
Okay, fine. And I'll contact you.
Welcome, sir. And I will also, you can text me.
We'll go ahead, definitely.
Yeah, sure, sir. We should do something for the society.
Yeah.
I have sent my number already.
Yeah, I got it. Thank you.
Any other questions or comments or experience sharing from any of the participants?
So, Dr. Divyang, I have one suggestion.
Sure.
I gave a talk on motivation to all the junior doctors of ophthalmology who are 35 and below. So everybody was down. So my talk was my life and Kung Fu Panda's life, 11 lessons learned. So in case anybody wants, I love the topic because I learn a lot every time.
We'll love to hear you. We'll have some other sessions, sure, sir.
Yes.
Definitely.
And even Dr. Raut can use me for your national webinars if you have. Idea was to motivate. But everybody is down with mentally. And I always feel, like when I went to Kashmir, this is what Shivanandan said. If you have even slightest doubt, don't go. And he said, if you have guts, you go to Kashmir. And when the curfew was there was a curfew alternated by government, alternated by public. That means 4 months, the entire city was a ghost city. And I went alone. And now entire world, all the, activists, as well as police, army knows me.
Now,
nobody has touched me.
What you said, Dr. Natarajan is absolutely right. The people were depressed, especially medicos and paramedical people. Even nurses were resigning, junior doctors were resigning. And
Correct.
to the height, I'll tell you, one of my consultants resigned from my hospital.
Oh.
So it's all because of great phobia about the corona infection.
Correct.
And those who are working forcefully, so even they were also depressed. So
Correct.
it is very essential to motivate them and give a correct idea. Of course,
certainly.
our COVID specialist has given a talk, 2-3 talk to the junior housemen, and actually at least we could maintain their number in the hospital, because there was 80% reservation from the government side. They told to have an 80% reservation in the hospital for the
Yes.
COVID patients. So maximum patients were COVID patients than other normal patients.
All right. Yes.
So,
So you're right, sir. Actually,
Yeah,
ophthalmology, we did a survey. 30% were in depression. 10% had a suicidal tendencies.
Yeah.
So I arranged a psychologist to talk, psychiatrist to talk, and I think Dr. Shashank Joshi is doing every month one webinar now. Earlier he did a lot, along with Dr. Harish Shetty. I think he's a psychiatrist. So I think it's important. And when I lost my grandmother, even Shivanandan took me for counseling. And I think I don't have any, shame to tell that, because I went into depression because not for COVID, but for in spite of so positive I am, when I was attached to my 103-year-old grandmother, I didn't learn mental detachment, because I always told Dr. Badrinath, I've learned mental detachment after operating retinal detachment. But now I could not detach my love and affection for my grandmother. But now I'm okay. So now I went to almost 3 weeks. Every week I went out for 4 or 5 days and spent time with my families and friends. So now I'm normal. So that's why I'm again with the Josh, I'm back. Now what I'm saying, sir, it is important for them to not to talk about COVID, only talk about positivity. How to see people are worried, they don't have work, or what will happen? I just finished MS. I have not done one surgery also. I'm going out of touch. I said, nothing will happen, I told them. I said, even if you fail MS or not written exam, 1 year mein kya hoega, sir, career mein? See, I have now 38 years experience. 1 year kaam nahi karega, kya hoega? Somebody will feed you, sir. We have friends. After all, we are doctors. We have hundreds of classmates, no? In my batch, we had 150 doctors. And all of them they will feed me, no? Every week, one fellow will feed me. So, no matter ho gaya. And we have only 52 weeks.
Yeah.
Dr. Siva, sir, you want to add on the discussion on the positivity and mental health?
Mental health, I think Dr. Natarajan has talked enough. I don't want to create any mental stress to anybody here. The thing with, first of all, Natarajan, it was an excellent talk.
Thank you.
Secondly, all of you may not be knowing that Dr. Natarajan does a lot of community service as a Rotarian. He's a past president and he's doing fantastic job even in Rotary, through Rotary to the community. And of course, Natarajan, I get all your information. I don't talk to you, but I get all the...
Even about you, I talk about you to Indu.
Yeah, but I also get the information from Akshay.
Yes, and I want to tell about Akshay. Most of the papers, Akshay is my co-author. The reason is, as Dr. Siva said, is the sister's son, as soon as she finished MBBS, today also I counseled one doctor's son, he joined me as an MBBS to work in ophthalmology. So he wanted to rotate with everybody, but he worked with one Dr. Vandana Jain. She has her own hospital. And he published 3 international publications in a peer-reviewed journal. And that's great of him. And now he's got the youngest guy with the highest number of impact articles in the journals. And I think he can probably, Dr. Shiva should motivate him to write some articles on publish on occupational health and ophthalmology. I think we should do that. And so he's a great, he's a consultant oculoplastic and ocular oncologist. Because ocular oncology is very few in India. And unfortunately, we have the retinoblastoma, which is the highest in India, in the world rather. 1 out of 1,500 births, I think, have a retinoblastoma. I am actually trying to create exclusive cancer eye hospital. In the beginning, I wanted to call it Aditya Jyot Cancer. Now I have decided Aditya Jyot name I don't want. I want a cancer eye hospital in Bombay. So whoever has clouds with anybody who's interested, so even Ratan Tata is my good friend. He is giving for general cancer, but somehow I don't know why he's not giving. I'm going to persevere and so Akshay, now I'm mooting the idea. We should have the biggest eye cancer hospital in Mumbai, where we have the Tata Cancer Hospital. But eye is a part of it, because we can save not only life, we can save vision also, which we cannot do now, because now what they do is most of the doctors, they enucleate the eye. That means remove the eye. Then nothing can be done. So Dr. Akshay Nair is trained in intra-arterial therapy and also various chemotherapy to save the eye, save the vision, and not removing the eye.
Thank you, Dr. Natarajan, for your another life goal, which one you discussed during your talk, and now second is the cancer eye hospital. So wish you all the very best, and I thank all of the participants.
Aditya? No, I only want to tell two more my ideas, because Paul Coelho said, whatever you desire, if it is intense and useful to the people, the whole universe will conspire to get it. So my third dream is I'm working on all the inherited retinal degeneration who are going blind, particularly RP and retinitis pigmentosa and many degeneration. So I'm working on inherited retinal degeneration on both medical therapy using a drug or gene therapy. In gene therapy, we have to have a gene vector which can be injected into the eye behind the retina. That means you need a retina surgeon to go behind the retina, detach the retina, and inject near the macula. So I'm working on it. So I'm actually saying, when I'm getting bored now, I'm planning to do a fellowship. And the third is using the artificial retina. Even though all are technologically advanced, but still not useful to a common patient. Each treatment, that the gene therapy is about 4 crore for one eye. And artificial retina is 2 crore for one eye, and it's for blind. So I am trying to do with the IIT Bombay, IIT Delhi. I don't know when I will succeed. I am telling all this because I want somebody to give the connections and wherever you are. And the fourth final goal is by 2027, now 7 years, I want to get the Nobel Prize for ophthalmology, not for boasting. And Nobel Prize will be given only when you do something in molecular level where it will benefit the whole world. Something like now whoever is working on vaccine may get Nobel Prize in 5 years later. So like that, I want to get something where you can remove the word blind from the world.
Excellent. And we all have the best wishes for you, sir. And
Thank
with
you.
your passion, zeal, and enthusiasm, I'm sure that you will. Why should not get this dream come true? Why wait till 2027? It may be earlier also. So all the
for that we have to meet Dr. Anil Naik, our friend.
Yeah, sure.
Yes.
So,
thank you.
Right. So with this, I once again thank you all the participants, and with special thank to Professor Dr. Natarajan, our National President Dr. Sidram Raut sir, our Mumbai President Dr. Ashish Mishra, who in fact has hosted this Zoom webinar. Our senior colleagues Dr. Sanwat sir, Dr. Siva sir, Dr. Rajesh sir, my colleagues Dr. Nikunj, Dr. Vishwajit, Dharmesh, also the participants from outside Mumbai, especially with a special mention of Dr. Sandeep Sharma. Dr. Natarajan, you will be surprised to learn that Dr. Sandeep Sharma is going to host the 37th webinar today at 6:30 on occupational health. So he's every Saturday 6:30. There is a webinar by IAOH-MUmbai Delhi branch, and with all, I thank once again and thank you all. Have a good day, and we will meet again at 6:30 again for a discussion on the pulmonary fibrosis topic hosted by Delhi branch. Thank you.
Sir, I only wanted to tell Dr. Nikunj, even for IAOH, ophthalmology related occupational health we should do one day. And we can do it with All India Ophthalmic Society officially, and Indian Association of Ophthalmology, the national thing.
Okay, sir. Sure. Thank you, sir.
Whenever you can take
Okay,
your
sir.
time. Even I need time because every day I have 2-3 webinars. Now I'm going to log into another one. Thank you so much,
Okay.
Dr. Nikhil, and entire my friends here, and Dr. Raut as the national president, Dr. Shiva for his kind words, and everybody, and Dr. Sandeep Sharma also for kind words. And I think now I have decided the last quote is from Vivekananda: "They alone live who live for others, like me. Rest are equivalent to dead corpse walking if you are working for yourself." Here, all doctors are working for others. Even though we are all getting money, you should be proud of taking your fees and then treating. And then because we are taking risk and treating every patient, and God will give us reward. Thank you.
Thank you.
Thank you, sir. Thank you.
See you all at 6:30.
Thank you.
Thank you.